Every 20 seconds, someone with diabetes loses a limb, and it starts with warning signs 90% of people ignore. If you have diabetes, your feet are sending you urgent messages right now. Here's how to decode them before it's too late. Here's what's happening inside your feet right now. High blood sugar is like acid attacking your nerves. First you lose feeling, then you can't detect injuries. Finally, small cuts become life-threatening infections. But here's what doctors don't tell you. This process is reversible if caught early. Neuropathy develops, it disrupts the nerve's ability to transmit signals effectively. This can lead to a loss of sensation in the feet, making it difficult to perceive pain, temperature changes, or even injuries. As a result, minor cuts, blisters, or sores might go unnoticed, increasing the risk of infection. Furthermore, diabetes can impair blood circulation, reducing blood flow to the feet. This reduced blood flow hinders the delivery of oxygen and nutrients essential for healing, making it harder for wounds to recover. The combination of nerve damage and poor circulation creates a vulnerable environment for foot problems to develop and escalate quickly. Do you have diabetes foot issues? If so, share them with the community in the comments section. Symptoms of diabetic foot problems. Recognizing the warning signs of diabetic foot problems. Are your feet screaming these next 5 warning signs? Number 1. Numbness that feels like wearing thick socks. Number 2. Feet that feel ice cold or burning hot. Number 3. Cuts that won't heal after 2 weeks. Number 4. Skin that looks angry red or ghostly pale. Number 5. Any discharge that smells foul. If you have even one of these, call your doctor today. One of the most prevalent signs is numbness or tingling sensations in your feet. Pay close attention to any sores or ulcers that heal slowly or don't seem to improve. These can be indicative of underlying issues that require immediate medical care. Additionally, be on the lookout for any signs of infection such as redness, swelling, warmth, or pain around a wound. If you notice any unusual discharge, such as pus, it's essential to contact your doctor without delay. Remember, even seemingly minor foot problems can escalate quickly in individuals with diabetes, so early detection is paramount to diabetic foot risks. The shocking truth about diabetic foot complications: that tiny blister can become a foot ulcer in 48 hours. That ulcer can turn into gangrene in 1 week. Gangrene leads to amputation in 30% of cases, but here's what could save your life. Most amputations are preventable with this simple daily routine. One of the most alarming risks is the development of foot ulcers, which are open sores that can penetrate deep into the tissues. These ulcers are highly susceptible to infection. In severe cases, can lead to gangrene, a condition where tissue dies due to lack of blood flow. Gangrene can be a limb-threatening condition necessitating amputation. In some instances, the risk of amputation is significantly higher in individuals with diabetes, highlighting the crucial need for preventive measures and early intervention. Furthermore, diabetic foot problems can significantly impact quality of life, limiting mobility and causing chronic pain. The impact extends beyond physical health, as the emotional toll of living with these complications can be substantial. Understanding the severity of diabetic foot risks is crucial for motivating individuals to take proactive steps toward care and seek regular medical attention. Tonight, before bed, do this 60-second foot check that could prevent amputation. Step 1. Use your phone flashlight to examine every inch. Step 2. Press gently. If you can't feel pressure, see a doctor. Step 3. Check between toes for cracks or moisture. Step 4. Look for any color changes or swelling. Step 5. Test temperature with the back of your hand. Do this every single night. First and foremost, prioritize daily foot inspections. Carefully examine your feet for any cuts, blisters, redness, swelling, or other unusual signs. Use a mirror to check the soles of your feet, or ask a family member for assistance if needed. Maintaining good foot hygiene is crucial. Wash your feet daily with lukewarm water and mild soap, ensuring to dry them thoroughly, especially between the toes. Moisturize your feet regularly to prevent dryness and cracking, but avoid applying lotion between the toes, as this can trap moisture and promote fungal growth. When trimming your toenails, cut them straight across and avoid cutting them too short. If you have difficulty reaching your toenails or have concerns about proper trimming, consult a podiatrist or healthcare professional for assistance. Remember, taking preventing measures is the most effective way to protect your feet from diabetes-related complications. If you found this information helpful, please click the like button and subscribe to our channel for more health tips. Your diabetes doctor should examine your feet at every visit. If they don't, ask why. You also need to see a podiatrist twice yearly minimum. Here's what to demand: nerve sensation testing, blood flow assessment, and custom shoe recommendations. Don't leave without a written foot care plan. During these appointments, your doctor will assess your blood sugar control, examine your feet for any signs of problems, and provide personalized guidance on foot care. They can also identify potential risk factors and recommend strategies to mitigate them. In addition to regular doctor's visits, consider scheduling appointments with a podiatrist, a specialist in foot care. Podiatrists are trained to diagnose and treat a wide range of foot conditions, including those related to diabetes. They can provide expert advice on footwear, orthotics, and other specialized care for your feet. Regular checkups are an investment in your long-term health and well-being. They allow for early detection of problems, timely intervention, and personalized care, significantly reducing the risk of serious complications. Make these appointments a non-negotiable part of your diabetes management. Your feet are your foundation for independence. Every day you delay action, you risk losing that freedom. Start tonight with the 60-second check. Schedule that podiatrist appointment tomorrow. Your future self will thank you. What warning sign will you check first? Tell me in the comments below. Seeking regular medical care and stay informed about your condition, you can make significant strides in safeguarding your foot health. Remember, knowledge is power, and understanding the risks and symptoms associated with diabetic foot problems is crucial for taking informed action. Don't hesitate to reach out to your healthcare team for guidance and support. Your doctor, podiatrist, and other healthcare professionals are valuable resources for addressing your concerns and providing personalized care. By working collaboratively with your medical team, you can develop a comprehensive plan to manage your diabetes and protect your feet. Taking charge of your foot health is a journey, not a destination. It's about making conscious choices every day to prioritize your well-being and minimize the risk of complications. Embrace this journey with confidence, knowing that every step you take towards foot care is a step towards a brighter, healthier future.